Hello everyone, myself lecturer Aditi Anil Kushare, Master of Pharmacy in Quality Assurance Techniques. Today we are going to discuss about the experiments from Pharmaceutics 2. So we will discuss about the introduction to solid dosage forms, that is powders and other oral unit dosage forms. The solid dosage forms are available mostly in unit dosage forms such as tablets, capsules, cachets, powders or tablet triturate. Powders. The pharmaceutical powder is a mixture of finely divided drug and or chemical in the dry form. They are solid dosage forms of medicament which are meant for internal and external use. Classification of powders are bulk powder for internal use, bulk powder for external use, simple and compound powder for internal use, powders enclosed in cachets and capsules, and fifth one, compressed powders, that is tablets, that are also known as tablet triturates. So first one we will discuss about the bulk powder for internal use. Powders are dispensed in bulk when accuracy of dosage is not important. They are supplied in the wide mouth container that permit the easy removal of spoonful of powder. Examples of that bulk powder for internal use are rhubarb powder, BPC, that is known as a Grigory's powder, compound bismuth powder. Second one, that is a bulk powder for external use. These are non-potent substances. These powders are supplied in a cardboard, glass or the plastic container. The dusting powders are supplied in a perforated or the sifter top container. The classification of this bulk powder for external use is first of all dusting powder, then insufflation, snubs and dentifrices. We will discuss about dusting powder. These are generally applied to the skin in very fine state to avoid the local irritation. Hence, the dusting powders should be passed through sieve number 80 to enhance their action. Classification of dusting powder is medical and surgical. There are two classes. We will discuss about a medical. These are used mainly for superficial skin conditions and sterility is rarely essential. Medical dusting powders are not intended for application to the open wounds or areas of broken skin. Surgical one, these are used in the body cavities and major wounds on burns and on the umbilical area of infants, hence they must be sterile. Insufflations. These are medicated dusting powders meant for introduction into body cavities such as nose, throat, ears and vagina with the help of apparatus known as insufflator. Insufflations should be finely divided powders so that a stream of fine particles of medicaments get applied to the site of application. Snubs. These are finely divided solid dosage forms of medicament which are inhaled into the nostrils for its antiseptic, bronchodilator and decongestion action. Snubs are dispensed in the flat metal boxes with the hinged lid. Then next one, fourth class, that is dentifrices, which is tooth powders. These are applied with the help of toothbrush for cleaning the surface of the teeth. They contain the suitable detergent or the soap. Some abrasive substances such as calcium sulfate, magnesium carbonate, sodium chloride are used in the fine powder. A strong abrasive substance should not be used as it may damage the tooth structure. Then next, third class, that is the simple and compound powder for internal use. This is the main class of the powder. Each individual dose is enclosed in the paper. In the divided powders, the number of ingredient may be one simple powder or more than one, that is compound powder. The minimum quantity of powder should not less than 100 milligram. Simple powder. A simple powder contains only one ingredient either in a crystalline or the amorphous form, which should be reduced to fine powder and wrapped as individual doses. Compound powders. Compound powders contain the two or the more than two substances which are mixed together and divided into desired number of individual doses. Fourth one, that is powders enclosed in cachets. Cachets are the solid unit dosage form of the drugs. These are molded from rice paper. They are used to enhance the nauseous or the disagreeable powders and are available in the different sizes to hold the drugs from 0.2 to 15 gram of powder. Cachets are of two types, that is wet seal cachets and dry seal cachets. Direction for this is immerse in water for few seconds and swallow with a draught of water. Then fifth one, that is a tablet triturates. These are the powders molded into the tablets. Molded tablets are flat circular disc, usually contain a potent substance which is mixed with lactose, dextrose or some other suitable diluent. Packaging and storage of these tablet triturates are packed in an airtight container to protect from moisture. General method of preparation of powders: during the powdering, weighing and mixing, there is a loss of powder which cannot be avoided. Therefore, calculate the quantity for one extra powder than required. It is difficult to weigh the quantity less than 2 grain or 100 milligram. As we know, 1 grain is equal to 60 milligram. On dispensing balance, therefore, this quantity must be triturated with a suitable diluent such as lactose. The crystalline substances are powdered separately and then weigh the required quantity of ingredient. Mix all the ingredients in the ascending order of their weight and mix thoroughly to obtain a homogeneous powder. Mixing of powders. Powders may be mixed by one of the following methods, that is a spatulation, trituration, geometric dilution, sifting and tumbling. Dispensing of powders involving special problem. A number of problems arise while dispensing a powder containing volatile substances, hygroscopic and deliquescent powder, eutectic mixture, efflorescent powders, explosive substances and potent drugs. So special considerations are done while dispensing such powders. Volatile substances. First problem is for the volatile substances. The volatilization of substances like menthol, camphor and the essential oils may take place. Incorporation in the powders or should be wrapped in the wax paper and outer wrapper may be any thick paper. Then second one, for hygroscopic and deliquescent powder, the powder which absorb the moisture from the atmosphere such as ammonium chloride, iron and ammonium citrate, pepsin, phenobarbitone, sodium bromide, sodium iodide. Such substances are supplied in the granular form or should be double wrapped. For deliquescent substances, wrapping in ammonium foil or plastic cover is advisable. Third one, that is for efflorescent powder. Some crystalline substances become wet or liquefied during trituration. For an example, caffeine, citric acid, ferrous sulfate, etc. This difficulty may be overcome by using the anhydrous salt or an inert substance. Eutectic mixture: when two or more substances are mixed together, they liquefy due to the formation of a new compound which has a lower melting point than room temperature. Example, menthol, thymol, camphor, salal, etc. An equal amount of any inert absorbent like magnesium carbonate, light magnesium oxide, kaolin, starch, lactose is mixed with eutectic substance. Packaging of powder for divided dosage form for internal use should be done appropriately. Double wrapping. White demi paper gives inadequate protection to volatile, hygroscopic and deliquescent substances unless it is lined with grease-proof paper. If greater moisture resistance is required, use waxed paper. The inner paper is cut a few smaller each way than the white demi and it is satisfactory to fold both the papers together. Sometimes it is necessary to wrap each packet externally in a aluminium foil. So in next session we will discuss about the actual experiment. Experiment number 86. Title of this experiment is to prepare and submit boric acid containing 1% of iodine 10 gram. In this we are going to study the solid dosage forms for external use. Proposition 1. Use of solvent facilitates the subdivision and distribution. Proposition 2. Iodine is soluble in alcohol which serves as a distributive agent. Learning objectives are to understand the purpose and method of preparation of dusting powder and ability to prepare and label a dusting powder with the liquefied substances. Apparatus required are glass mortar, pestle, spatula, etc. Factor calculated as quantity required upon quantity given is equal to 10 upon 100, that is equal to 0.1. Prescription is given over here by the symbol Rx. Send 1/2 OZ means ounce boric acid containing 1% of iodine. As we know, this is for 1/2 ounce. 1/2 ounce. As we know, the 1 ounce is equal to 30. That's why 30 divided by 2. That is 1/2 ounce means 15. And 1%. Percent stands for 1 gram should be dissolved in 100 ml or 100 parts, whatever. So 1 gram in 100 ml, that is nothing but 1% iodine solution. So let's discuss in detail about the formulation table. Type, category, use or role of ingredient. Translation means the name of ingredient. Quantity given in imperial system for preparing 100 gram. Quantity given in metric system to prepare up to 100 gram. Taken quantity should be for preparing 10 gram. Boric acid used as a preservative. Quantity given in imperial is 1/2 ounce. As we already earlier discussed, 1 ounce is 30. So 30 upon 2, that is 15 gram. Taken quantity should be 1.5 gram. That should be calculated with the help of factor. Iodine used as antiseptic and antibacterial. Quantity given in the imperial is 1%. As we know, 1%, that is 1 gram in 100. So for preparing 100 gram, 1 gram quantity should be given in metric system. So taken quantity should be 0.1 gram. This is also calculated with the help of factor. Alcohol used as a distributive agent to dissolve or to solubilize this iodine. It is quantity given in imperial is quantity sufficient. Taken quantity for preparing 100 gram, that should be quantity sufficient to prepare 100 gram. Means on an average approximately 100 ml should be required, and quantity taken in metric system, that is quantity sufficient to prepare up to 10 ml or to prepare up to 10 gram, whatever. Direction for external use only, to be used as directed by physician. So we have, this is iodine, this is boric acid, and this is alcohol. So first of all, I am going to take these iodine crystals into this glass mortar, and after that I am going to add this alcohol into it and then properly mix and solubilize this iodine into this alcohol. After proper mixing of these iodine crystals into this alcohol, now I am going to add this boric acid into it. And after that it is again properly triturated till its complete mixing. Now after complete mixing of it, I am going to transfer it into this amber colored wide mouth bottle, and then we will proceed for next labeling part. So we will move towards labeling of formulation.